Okay, so scene is safe, we're wearing the correct PPE, which is gloves and glasses, and if the baby's just been delivered, a gown. So you want to call for backup and move the baby to an area suitable to initiate resus. You can stimulate the baby by firmly drying to see whether that helps. You want to make sure that you've got your equipment prepared, so a BVM, the correct size mask for the baby, and any oxygen as well. So we need to assess the baby, so assess their colour, tone, breathing and heart rate. With heart rate, obviously just with the stethoscope, just checking the heart rate. And then as you hear it, tap it out on a firm surface so that others can hear as well. Okay, so if the baby isn't breathing, so we need to assess the airway. So you want to place so this little baby's flat at the moment, obviously it doesn't look like it, but you just want to place the baby, open the airway and place the baby in a neutral position so that where the baby is parallel to the ground. And then if there's any obvious like blood or mucus or anything like that in the airways that are obstructing it, you can suction carefully. So breathing, you want to do 5 aeration breaths with the mask, the appropriate size mask and the BVM. So you want to do 5 long sustained 2 to 3 seconds each, and then making sure that you're checking that the chest is rising and falling. You then want to reassess again, so reassessing the colour, make sure they're not cyanosed, tone and breathing, and again heart rate. So listening with the stethoscope and then tapping it out on a hard surface. So if the heart rate is still slow, you want to give around 30 seconds of ventilation breaths. These ones are a lot quicker, so it's generally 1 to 2 seconds. And with oxygen as well. You then want to reassess, so the colour again, tone, breathing and heart rate, so using the stethoscope and then tapping out on a hard surface. If the heart rate is below 60 beats per minute, it is then recommended that you start cardiac resuscitation, so you want to do 3 chest compressions to 1 ventilation. So using your 2 thumbs on top of each other and sort of internipple line centrally on the sternum, and you just want to push down 1/3 of the depth for 3 times and then 1 ventilation breath. You then want to reassess after 30 seconds. So again, the colour, tone, breathing and heart rate. And then obviously rapid transport.